My name is Kathleen Gallagher. I am the VP of Health Services Research here at Patient Advocate Foundation. I'm predominantly responsible for designing, collecting, analyzing, and sharing data that represents our patient population. And today we're actually going to do a brief caregiving spotlight, kind of showing you how patients who interact with Patient Advocate Foundation utilize and leverage caregivers when seeking service. So the first thing, just to level set, I just want to touch base on the actual, Webster Dictionary definition of a caregiver. And this is somebody who is a person who provides direct care, and this can be for children, for the elderly, or for the chronically ill. So the first thing that we want everybody to do is, when you think of individuals who can have the role of a caregiver, what is the first single word that comes to mind? Now, if you look in the chat box, there should be a link provided. And for the next 60 seconds, we're going to invite everyone to go ahead and give us their definition. Give everybody about 20 more seconds to go ahead and enter their word. All right. So it's interesting. We were looking more for the role, and I was thinking that people would select words that described a person, not so much words that would describe the essence of individuals who are caregivers. Which is interesting because I was anticipating seeing a lot of words potentially relating to roles that we traditionally think of as caregivers, as people who may be in a paid position. Whereas a lot of the words that people described were the emotional aspects of caregiving. So really, really, really interesting to see. But one thing I just, I wanted to highlight, and I'm sure other presenters throughout the different conversations that you guys have been having today have really hit home, that if you look at the definition of caregiver, it really isn't a role that stipulates that there's a payment for service. It really is a loving role, a giving role, and a role that often falls to people who may or may not traditionally identify themselves as a caregiver. So at PAF, we do collect some information from our patients on whether or not they do have a caregiver. However, the terminology that we use is slightly different. And we frame it within the context of asking patients if they would like to designate a point of contact. So a point of contact can serve as a proxy for the patient, it can serve as a proxy for their caregiver, and it's definitely an individual who helps patients access our services. So when we went back and looked at data over the calendar year 2020, we saw that about 1/3 or 29% of patients who were served by our case management team included this point of contact when they called in for assistance. Not surprisingly, 43% of the patients who were male included a point of contact versus women at only 35%. And these points of contacts actively support patients as they access and receive services from PAF, and work very hard with the case manager to ensure that they receive the resources that they need. So when we think about how we identify a point of contact or a caregiver role, when we looked at that 30% of patients who reported one, not surprisingly, you can see that 33% indicated that their point of contact was a family member, 26% listed a partner or spouse, 10% were parents. There were 5% who actually listed the caregiver as the point of contact, followed by friends. And then for a small percentage of our patients, a caseworker was serving in that function. So it is important to note that when we talk about this point of contact, this is somebody who is not serving as an emergency contact for the patient. It's definitely an individual who's actively assisting them with their care. So to wrap up this brief spotlight presentation, again, I'm going to invite everybody to use the chat function, but we wanted to drive a little bit of what would be an open-ended conversation. And so what we're asking everyone to do is to think about these 3 questions, indicate which question you're responding to, which would be 1, 2, or 3. And what we want to know is, do you feel, is caregiver support universal? How do different factors impact caregiving? And just to give you some things to think about, there are cultural factors, there are family or community factors, there's financial factors, and there's also factors that relate to the disease or condition that the individual is being treated for. And then we also want to know, what are other factors that can impact caregiving? So if everyone will please take a few minutes, think about these 3 questions. You can choose to answer 1 or more. Write your response into the chat box, and we will collate the responses that everybody shares with us. And then, as I mentioned earlier, shortly before the break, we'll come back and we'll give you the highlights of this group's interpretation. So I appreciate everybody's time today. I apologize for the technology glitch, but I hope everybody has a wonderful afternoon, and I look forward to sharing the responses to these questions. Thank you.